Welcome back to HealthpulseAi, where we break down important health topics so you can stay informed and healthy. Today, we're talking about leptospirosis, a bacterial disease that affects both humans and animals. Let's dive into what you need to know. The bacteria can survive for weeks to months in water and soil, making it easy to contract during rainy seasons or floods. P.S. Professions like farming, sewage work, fishing, and veterinary medicine are at higher risk. Leptospirosis is often contracted through cuts, abrasions, or mucous membranes like the eyes, nose, or mouth. It can spread during floods, natural disasters, or through activities like swimming in contaminated water or contact with infected animals. Leptospirosis symptoms can vary widely. Some people may experience flu-like symptoms like fever, muscle aches, and chills. In more severe cases, it can lead to kidney or liver damage, respiratory distress, and even meningitis. These severe forms of leptospirosis are known as Weil's disease. Symptoms can appear anywhere from 2 days to 4 weeks after exposure, and they range from mild to severe. The early symptoms often resemble the flu and include fever, headache, muscle aches, and vomiting. However, in more severe cases, leptospirosis can lead to life-threatening conditions such as kidney damage, liver failure, meningitis, or even hemorrhaging. Leptospirosis has a biphasic course, meaning it occurs in 2 phases. 1. Acute, septicemic phase lasts 4 to 7 days. Symptoms: high fever, muscle aches, headache, nausea, chills, and red eyes. The bacteria are present in the bloodstream, causing flu-like symptoms. Second immune phase follows a brief recovery period or continuation of symptoms. Symptoms: recurring fever, jaundice, kidney damage, meningitis, and in severe cases, bleeding and organ failure. The immune system responds, which can cause inflammation and damage to organs like the liver and kidneys. If untreated, the second phase can lead to serious complications, such as Weil's disease, with kidney and liver failure. Blood and urine tests. The primary method is testing blood or urine for the presence of Leptospira bacteria. These tests are crucial since early symptoms resemble other diseases like the flu or dengue. ELISA, enzyme-linked immunosorbent assay, detects antibodies produced in response to the infection. PCR, polymerase chain reaction, can identify bacterial DNA, useful in early detection. Microscopic agglutination test, EMAT, considered the gold standard but may take longer for results. Antibiotics. Early treatment with antibiotics like doxycycline or penicillin is effective. These should be started as soon as leptospirosis is suspected. Hospitalization. Severe cases, especially those with complications like kidney or liver failure, require hospitalization for IV antibiotics, intravenous antibiotics, dialysis for kidney damage, supportive care for respiratory or liver failure. Early treatment significantly reduces the risk of severe complications. Fortunately, leptospirosis is preventable. If you live or work in high-risk areas, here's how to reduce your risk of exposure. Wear protective clothing and boots when working in waterlogged environments, especially in areas with known rodent populations. Avoid swimming or wading in water that may be contaminated, and always cover cuts or wounds when working outdoors. Leptospirosis is a serious infection, but with awareness and preventive measures, we can reduce its impact. Be cautious, especially during rainy seasons or in high-risk areas. If you suspect you've been exposed or are experiencing any of the symptoms we've discussed, see a doctor immediately. If you found this video helpful, please like and subscribe to HealthpulseAi for more health insights and tips.